Hey guys, Rena, Malik, urologist and pelvic surgeon here. Today I want to talk to you about how you can reach your doctors during this really uncertain time right now. I also am going to at the end talk about some telemedicine platforms that are available for physicians. So if you are a physician or a provider who sees patients virtually, make sure to stick around till the end because I'm going to talk a little bit about that as well. It is harder and harder to see your doctor about just routine clinical care. And sometimes there are things that you do have questions about or want to reach your doctor about. So, what can you do about that? Well, most providers and physicians these days have access to telemedicine. Medicare has done a good job of allowing us as physicians to use multiple platforms in order to reach you. So as long as you have a smartphone or a computer, which I'm assuming all of you do because you're watching this YouTube video right now, you'll be able to see your doctor virtually. And what are the kinds of things you can see a urologist for virtually? Well, you can see them for things like overactive bladder. You can see them for things like urinary incontinence, for benign prostatic hyperplasia. You can see them for low testosterone, erectile dysfunction, and blood in the urine. The reason that is we can at least discuss with you the symptoms that you have, discuss ways that you can manage these conservatively, and potentially put you on medications that might help you. We certainly can't schedule your elective surgery right now if that's where you end up needing to go, but there are certainly other conservative options or medications that we can prescribe. Do realize that we are limited because we can't do a physical examination on you. So we will ask you questions about your physical health. If you feel, for example, I'll ask my female patients if they feel a bulge or if they feel like they're emptying their bladder completely, because that's the only way that I can really assess because I don't have them in my office. We also can't check your vital signs. So I can't check your temperature or your pulse. We can't check your blood pressure. So those things, if you are feeling really unwell, there's a certain point where you have to go to the emergency room. We will see some patients who have urgent needs in the office, at least at my institution, and you'll have to call your doctor's office to see if their doors are open to see urgent patients. Because my goal and all of our goals as providers is to keep you out of the emergency room. We don't want you to end up in the emergency room where there are hundreds of sick people where you might contract infectious disease like COVID or other problems. So at this point in time, that's my main goal. The surgeries that are happening are all urgent or emergent cases. So emergent cases are ones that come in through the emergency room, like testicular torsions, penile fractures, kidney stones that are obstructed or have infection at the same time, or things that are imminently going to end up in the emergency room. Like if someone needs a Foley catheter because they can't pee, we can do that in the office so that you don't have to go to the emergency room. Or if we know that imminently, if we don't take care of you, you will end up in the emergency room with an infection or things like that. Also, for my patients who have recurrent urinary tract infections, I realize this is a huge problem because you can't go in to see your doctor, but this is a perfect indication for a virtual visit. We can assess your symptoms. We can send labs to you. We can send them to the lab that you're going to so that you can go drop off a urine sample at a lab near you. So you don't have to come to the hospital. You don't have to go drop off your urine in a place that's really far away from your house. So these are things that we can absolutely do and may save you a trip to the emergency room in the long run. So please reach out to your physicians and see if they have telemedicine access or virtual visit access or even telephone visits. So on the day of your visit, you will first be connected to an MA or a nurse, at which time they will go over a verbal consent with you. So basically, you need to realize that you're getting a visit over a phone or a video platform, and whoever is in the room with you will hear your medical history. On the other end, we will do our best to keep things secure and make sure there's no one besides us listening to your medical history, but there are chances of security breaches anytime you're using some sort of electronic or virtual platform. So we go through all these things with you. We also let you know that because we can't do a physical exam, we are limited. And then you have to agree to proceeding with the virtual visit. Then they will ask you about your medications, your past medical history, your past surgical history, and then they'll pass you on to a virtual waiting room where you'll wait to see your physician. Then you'll see your physician, just like you're seeing me right now. You'll see me on your phone or your computer, and we'll talk about your problems. The only part of the visit that will be different than what you normally expect is that you won't have a physical examination. So I would typically tell patients, I can't tell you definitively what your exam shows because I can't see you unless I can see, unless there's an incision or something you want to show show me on the video, you can show me that, but typically there's not a lot of exam going on. So then we'll tell you what the treatment options are for your particular problem, tell you anything, warning signs or things to look out for if we start you on a medication, particularly any side effects or things like that. And then we'll set you up for a follow-up visit. And that will hopefully be in the office if we have never done an exam before, at some point when it's safer for you to be traveling outside and coming to the office. If not, we'll continue virtual visits as long as we have to. I think this is a great option for patients to be able to still connect with their provider. And I hope that this continues even long beyond COVID-19. I think that this is a really great option for follow-up patients who are maybe just on a medication and need to see you once a year. You get to skip the driving to the office, finding parking, waiting for your doctor, waiting in the waiting room, waiting in the exam room, all these things. You can wait in the comfort of your own home, which is really great. So I hope this is informative for all the patients who are about to use any sort of virtual visits. And now I'm going to move on to telemedicine platforms. Great option that I've heard about and I haven't personally used is doxy.me. So it's through Doximity. They have a free version. They also have a professional version, and then they have a clinic version, so they can actually brand it to your clinic. So the last option I want to talk to you guys about is Pulse telemedicine. So I'm going to be completely transparent here. My husband uses this, and also because he liked it so much, he actually invested in the platform. So this is an app which allows you to communicate with your patients all within the app. You can bill through the app, you can see the patient through the app, and you can have constant communication with the patient. It's a really great option for you if you want to build a very special relationship with your patient. The other thing about this platform that's great is actually created by a physician. So it was created by one of my friends who's an ophthalmologist. And if you guys decide to use this platform, I'll link it down below. And if you call them and let them know you got the information from my YouTube channel, they'll give you a discount. It's a great platform, and I highly encourage you guys to check it out. They're doing their best to help out all of the providers who are struggling during this time and have to close their doors so that you can continue to keep connected with your patients. I would really like it if all patients and providers can continue to connect with each other, especially during this uncertain time. Your problems are still extremely important, but right now we have to do things very, very safely and prioritize those who are very, very sick to protect everybody. And so I want you to know that all of us physicians, we care about you. We want to take care of all your quality of life issues, all your non-urgent issues as best we can during this uncertain time. So always remember to take care of yourself because you're worth it.